CW Plus is the charity arm of the Chelsea and Westminster Hospital NHS Foundation Trust. We focus on creating exceptional clinical environments, so we help the hospital build fantastic new facilities. We work on improving patient experience, that's through a variety of different means. And we also have a big focus on digital innovation and work with our hospital colleagues on a programme called CW Innovation, looking at that. The use of digital has been transformative in terms of how we're able to better and faster meet the needs of patients. So CW Plus has been working with ORCHA to create the UK's first dedicated app library for young people in need of mental health support. And this came about through a programme called Best for You. Best for You is a programme that runs across North West London. It is a coalition of organisations, including 3 major NHS organisations, Chelsea and Westminster, Central North West London, the big mental health trust in this part of town, and West London Healthcare, who focus on community and mental health support across the region as well. And we came together and looked at how we could improve everything from the experience of young people in mental health crisis who are coming to A&Es, all the way through to actually how do we start thinking about switching the dial to prevention. The feedback we've had from clinical colleagues has been incredibly positive. Digital is becoming an equal part of that kind of armory of tools that our clinical teams have. And having an app library which has been vetted and validated by their peers in this part of London is really, really important, because that means that they have the confidence to say, actually, there are certain things we can use here. But also that means that they actually have some data coming back to them, and it's not that detached relationship that historically has kind of meant that digital has been there as something that might be able to help you, but I'm not really sure whether it will, because I'll never know whether you use it effectively or not, or whether you've actually used it at all. So we've already seen over 1,000 sessions from across the country of people using the app library, and that's in only 2 months since we launched it. What it tells us is that this is something that people were looking for, having that trusted and validated kind of one-stop shop for digital health tools for young people is something that clearly that service users and clinicians are starting to tap into. So from our perspective at CW Plus and Chelsea and Westminster, working with ORCHA was really the only option in terms of being able to create the kind of app library that we wanted to deliver. Because ultimately, if we get this right, this is about keeping people as people and stopping them from becoming patients in the first place.